Quickly an AOB from me. We had some sad news from Newham Hospital that I've been asked to pass on to all the GPs. So one of the ED consultants, Dr. Bill Coob, unfortunately passed away last week, or very suddenly. He was in work on the Monday and then unfortunately didn't turn up on the Tuesday. They've just asked me to pass it on because I know a lot of GPs knew him very well. For those of us like myself who trained in Newham as well, he was there always in ED as an excellent trainer for all of us. He was very, very dedicated to all his patients. He in the ED department worked tirelessly, always worked on Christmas Day consistently. So it's a massive loss for us, and I just wanted to pass on that message to you all. I think Helen Parker has sent a small sort of kind of email around to Bart's staff. They may do a memorial service at some point, but I'll send around details once some of that comes out. But I thought I'd just let you know. So yeah, sad news, but thank you.
Thanks, Rima. And then the last item on the agenda is Minnie. Minnie's going to be speaking to us about the COVID-19 inquiry, and I think that we all, like all of us individually in our personal lives and as well as at work and general practice in Newham, you know, we've had a tough few years during the pandemic, and I think we've all learnt something or felt something, or it's affected us in some way. So I think that this piece of work that's being done is really vital. So thanks, Minnie, for coming to us today.
Not a problem at all. Thank you so much for having me. And just from kind of being on the call for the kind of 20 to 30 minutes that I have been, it's so clear that, you know, you're such a kind of passionate group of GPs, and you have so much that you could share and that you could tell us about the lessons that we need to learn. So without further ado, I'm here to talk about Every Story Matters, but I'm just going to introduce the kind of the COVID inquiry first. If I could go to the next slide, thanks, Dad. So the COVID inquiry is the independent inquiry set up to examine the UK's preparedness and response to the COVID-19 pandemic, and crucially to learn lessons for future. So I won't go into too much detail, but the inquiry is split into modules. So we have a module on healthcare, for example, which will investigate healthcare in more detail, and that's in autumn 2024. You may have seen in the news at the moment, we're looking at kind of political decision making. So it's split into different topics so that we do justice to the kind of the breadth and depth of things that we need to explore in relation to the pandemic. I'm going to pop a quick link in the chat to our newsletter, just in case anybody wants to sign up to kind of hear more about the inquiry's progress, its investigations, and eventually our recommendations. If I can move to the next slide, please, Steph. Fantastic, thank you. But really, I'm here to speak to you today about Every Story Matters, which is your opportunity to tell us about your experience of the pandemic, and as I said before, critically, the lessons that you know need to be learnt. So you may have seen kind of Every Story Matters at bus stops, on social media, etc. But as I said, it's your opportunity to tell us what happened during the pandemic, essentially. Can we go over to the next slide? So Every Story Matters, within Every Story Matters, we are asking you to tell us about your experience, to tell us about the effect that the pandemic had on you and those around you, and then finally what you think could be learned for the future. If we can move to the next slide. So there's quite I might miss out this slide just in terms of speed, if that's okay. Is basically saying that the legal investigations look into kind of policies and what happened and why, and then Every Story Matters provides us with that kind of crucial human impact. So what was the impact of that particular policy and what could be done better? So you might be wondering how you can feed into this. So we've got a couple of ways. We've got the online form, which can be accessed at everystorymatters.co.uk. We've also got accessible versions of that online form. But really what I want to talk to you today is about our community events, because the COVID inquiry is going to be coming to Newham in just under 3 weeks' time. And we're really keen to speak to GPs in person, if possible. So if we go on to the next slide, Steph. So we've already kind of done a couple of events across the country, and next week we're going to be going to Carlisle and Wrexham and Ruthin, and then on week commencing 27th of November we'll be going to Exeter and then to Newham. So the inquiry is going to be in Newham on the 29th and the 30th of November. So just go on to the next slide. So in terms of kind of how we've developed Every Story Matters, the form's been designed in collaboration with those most impacted by the pandemic. And if you were to come and share your experience in person in Newham with us, then there will be at least one counsellor from our emotional support provider present. All of our staff are kind of trained in safeguarding and support, and we're looking to give people as much choice as possible. And I'll come on to that when I talk about kind of what we're going to be doing in Newham. And we've got the kind of 6 key principles of trauma-informed practice at the bottom there, which we always try to bear in mind when we're designing opportunities to listen to people's experiences of the pandemic. Go to the next slide. So I guess we've got kind of 2 key call to actions for you here. The first is to search Every Story Matters. If you would prefer to kind of write your experience down into an online form, you'll be able to find Every Story Matters online form where we ask you to fill in those 3 kind of key questions that I went through before. If we go to the next slide. Or it would be fantastic if you were able to attend any of the events that we're doing in Newham on the 29th or the 30th of November. So we'll have a public stand in the Stratford Centre on Wednesday the 29th of November where you can come and kind of understand more about what Every Story Matters is. But we're really keen to hear kind of specifically from GPs, and we want to run a GP specific listening event on Thursday the 30th of November. So if anybody was interested in kind of attending an event where you could speak directly to a member of inquiry staff about your experiences, then please do get in touch with us. I'm going to pop the email address into the chat now, but please do get in touch with us to let us know if you are interested. We haven't organised kind of like a venue, etc. yet, because we're really keen to be led by you. It's clear that you have lots and lots of other priorities, so wherever we can kind of slot in best will work best for us. I've just seen there's some messages coming through the chat in terms of convenient time. I think we can do most times on Thursday the 30th of November, so that's our kind of time frame. Other than that, we're really keen to work around you to kind of hear about whether it's best to run an event in a GP surgery in a private room, or whether it's best for us to kind of hire a space and do that then. But yeah, please do let me know via the email address that I put into the chat if you would be keen to come and share your experiences of the pandemic, but critically the lessons that you think could be learned for future pandemics with us in Newham.
Thank you, Minnie. There's an overlap in the chat bar of questions for the previous speaker as well. There's Karen's quite rightly asked, how will GPs be able to speak in public forums when we're worrying about patient confidentiality concerns? So in terms of the GP forum, that wouldn't be public, so that would be a private space. And going back to what I said about kind of choice, we would really want to give you the choice as to whether you would rather do this kind of one-to-one, so speaking to a member of inquiry staff or one of our facilitators, or whether you would like to, speak to us as a group of kind of 6 GPs in a private space. So
firstly, I don't think we're expecting you to speak in a public forum. And then on patient confidentiality, we would ask that you don't kind of speak about any personally identifiable information in the session. And even if you did, because, you know, it sometimes might come up when speaking about something, we would not be noting that down. And what would happen with the kind of the group session, if people did want that, is that we would send around notes afterwards, and you check you're happy with those notes, you check that you know, if there are any redactions that you wanted to make, because yeah, we want you to feel as kind of in control as possible of what will be shared with the inquiry. And then also just to say on that point, we're a public inquiry, so we don't exist to kind of follow up on individual cases of harm or death. We are looking to kind of learn lessons at the systemic level about what happened. So that's why we want to talk to you. And as I said, it sounded like from previous conversations that you'd have a lot that we can learn from.
Thanks, Minnie, for clarifying that. And I think Wax has shared some thoughts about what he was feeling. So it might be worth, I don't know if Wax, you're interested in being part of the GP listening part of things.
Yeah, if possible,
yeah.
Absolutely.
Karen?
Thanks, Minnie.
Just to say, if colleagues wanted to, and no need to, I'd be very happy for NHC to bring some coordination if people want to do it in that way, and we can make sure we pass it all through. I've heard stories along the way, and I would encourage people to share them. I think, you know, there's a lot of value in that learning.
Thanks, Karen. Okay, does anybody have any other questions for Minnie? No? Okay, thanks, Minnie. I'm sure we'll a few of us will be in touch. And Karen will liaise with you as well.
Sorry, I was just writing into the chat, but that is fantastic, and any help that you could provide with our investigations by sharing your experiences and the lessons that you think should be learned would be invaluable. So thank you very much. Thank you. Okay, so we've made it through the agenda. Sorry, I'm trying to keep to time. I think we're doing just that though. So was there anything else that anybody wanted to raise or Toyin?
Hi, yes, I'm from the CEG, and I just wanted to mention about going back to the medical examiners section, that there is actually a template that you can use in conjunction with the referral. So if I can just quickly share my screen.
I think Toyin, the Dr. Kartika did show the form to us.
This is,
I think there's an Emis version.
Oh, the template. Okay.
Show that
the
one.
template, yeah. So basically, if you populate this template, it will pull through what you've put here into most of the referral. So it saves you from having to write things twice. So and yeah, so the name
you put the feedback on there as well. So if there's any problems or issues with the template, populating the form, etc., we can just directly get back to you.
Yeah, and we can fix that and publish another version. So it's called the Medical Examiner's Template, just to let you know.
Oh, brilliant. Thank you. Thanks for sharing that with us, and thanks for showing it as well. Great. Okay, so I think that brings us to the end of the meeting. So today is the first day of Diwali for those of us that are celebrating. So on behalf of NHC and myself, I'd like to say a happy Diwali to everybody. Enjoy some time with family, friends, and wishing everybody a healthy, wealthy and prosperous new year. So have a lovely weekend, and we'll see you at the next webinar. Thanks, everybody.